Welcome to the Nutritious and Delicious podcast. I'm your host, Bethany, and I've been in the health and wellness space for over 17 years. As a previous health nurse, now certified holistic nutritional consultant, I help clients with their hormone health, fertility, and family health. Join us on this journey as we connect with experts from around the globe, sharing insights and personal stories along the way. So I'm super excited. Today we have the amazing Parnian. So welcome.
Thank you. Hi, everyone. I'm very excited to go through the podcast. Thank you for the invite.
Yeah, so I'm going to introduce you here. So basically, this is like, and I love this one because this is very unique to me. So Parnian is actually the founder and CEO of Fibra Inc. and is a distinguished biomedical engineer with a bachelor's degree from the Toronto Metropolitan University. And she also has a master's from the University of Toronto. Parninier's career reflects a commitment to technology, entrepreneurship, and fostering diversity in the industry. Now, Fibra here is the future of women's health. It is a data driven women's health platform giving women personalized, accurate reproductive health data, starting with fertility. So, this is perfect. This is so perfect for our guests because a lot of the women that we connect with are struggling with exactly this hormone health, fertility. So, the title really of our podcast today is The Future of Reproductive Health with smart underwear. So that's kind of an interesting one, underwear at the end. So I'd love for you to kind of give us your story and your background and how you started, because this is something I think amazing that everyone needs to hear.
Thank you. Yeah, for sure. So, I studied, as you said, I studied biomedical engineering for my undergrad and my master's. And throughout my education, we learned a lot about wearable devices that tracks your heart health or your brain health. And I always thought to myself, why not have a wearable device that tracks your reproductive health? Why, as a woman who's living in a developed country, I live in Toronto, so as a woman who lives in a developed country, in a very urban city, I have to wait for weeks, in some cases like months, to get
Yeah.
my appointment, undergo a lot of invasive and costly procedures, and wait for weeks afterwards to get the minimum data on my reproductive health and system. Access to the data and having a non invasive and instant kind of continuous monitoring method for reproductive health has always been one of the need for me as a woman myself. And then after I was done with my master's, I spoke with a few of my friends, and they were also experiencing the same problems and issues as I was facing. And from there, I kind of brainstormed in terms of how we can have a wearable device that gives you valuable information about your reproductive health.
Right.
Everything started for me actually 2 or 3 months after I was done with my master's. I came up with this idea. I kind of finalized it. I spoke with many women in the early days, but then once we officially started Fibra, I also did a lot of interviews with women as well. We spoke with 600 women who were going through some types of problems with their reproductive health. Some of them were going through fertility problems. Others were going through being diagnosed with UTI multiple times, and others were actually being misdiagnosed and for the situations, not for conditions, that was actually menopause or perimenopause.
Uh,
So that gave me a huge motivation actually from the beginning to want to do something about it and to want to actually again come up with this wearable device that non-invasively can track your reproductive health at home with just the click of a button essentially.
wow. Interesting. I love it because we've never had anybody on here talk about like underwear. Underwear being like the new, like smart,
Yeah.
like you said, like smart wearable, because we all have like the ring, like you can wear
Yeah.
or the watch or anything like that. And this is all kind of up and coming and new things that are coming through. So
Yeah.
how does,
And
sorry, go ahead.
rings and other methods of wearable devices are amazing. They also provide a wealth of knowledge and a lot of useful data and information, but they have limitations in terms of the types of the useful data that they can provide to you.
Right.
And we can actually talk about it in the other questions as well. But with our product, what we are doing is that we are also providing useful, specific insights related to your reproductive health because of the form of the product. And I'll elaborate more on that as we're moving forward.
Definitely. So kind of a little bit as well personal. So like what kind of made you kind of get like into this? And I know you said sort of women's health for
Yeah.
yourself. It must have been something like you're so young, you know what I mean? Like I'm sure people
Mhm.
say that to you all the time, but like you have a very driven mindset. So what kind of got you sort of going in that aspect?
Yeah. So I've always been a type of person that I would always think about everything from a critical point of view. So I would always criticize like why we are doing this like this, so whatever that was, and why we are not doing it in a more efficient, a better way.
Mm,
And studying engineering really also strengthened that kind of that part of my personality in terms of being a critical thinker and also being a solver.
yeah,
Um, and being a problem solver is one of the most important and prominent quality that we look for in every candidate that we hire at Fibra. We are a team of 15. We have different engineers, different scientists on the team. And one of the very first questions that I ask each and every one of them when I'm doing their interview is, tell me about a time when you had to solve a problem in the most creative way to actually get a response or to actually get a solution as fast as possible and as cheap as possible. Because these types of qualities and personalities in a candidate are very important for
yeah,
those who are joining a startup or those who are joining a company who's working on a solution that has never been worked on before.
right.
We face a lot of challenges every day, and it's very important to be a creative problem solver. Now, these parts and aspects of my personality was something that kind of nudged me a little forward in terms of again wanting to do something about the current state in terms of women's reproductive health monitoring
Mhm.
or women's access to the reproductive health data.
That's amazing. I it makes me think of myself and also my kids as well because the way you think is very unique, which is great,
Mhm.
and that's a leader quality. And the things that stood out when you were talking to me was making things better. So it's like I could imagine as a child you were probably always like, well, this doesn't like I could figure out a better way to make this work, and that's a great
Mhm.
quality. Problem solving, and then also being super resourceful.
Mhm.
And again, running a team like that, you want those kind of people because you don't want people to follow. You want people to be very innovative and resourceful. And
Absolutely, absolutely.
yeah,
And over the last 3 years that we've been operational, we've had amazing hires, and we've also had hires that were not a great match to the company.
yeah,
And through those experiences, it was actually a very kind of great learning curve and learning experience for me as well to be able to kind of see and look for these types of qualities in the candidates. For example, an example that I actually mentioned to everyone that I'm interviewing is that it's very important for us that we have team members who, let's say, if something is broken, they just try to find the easiest, fastest solution. Like you just get a scotch tape, attach it together, move on to the next part of the problem that you're solving,
right,
as opposed to having to do months of research, having to send it to other companies to see if
right.
they come up with a specific glue to put these things together. The speed is very important for us. And thankfully, everyone that we have at the team right now, at this stage of the company right now, they are amazing, creative problem solvers. Every day, they amaze me with the level of creativity that they come up with. And more often than not, we do a lot of brainstorming sessions together. We have different teams. We have a hardware engineering team. We have a data science and machine learning team. We have a sensor fabrication team. We have marketing team, and we also have a material science team. And I'm the one who's actually in contact with each and every one of them.
Hmm.
And another quality that is very important for us is also being a good communicator, because
Hmm.
each of these groups that I mentioned, they speak in their own language and
Yeah,
technical terms. Everyone is speaking in English, of course, but they are speaking in different languages. And sometimes when they communicate with each other, it's although that they think that they are giving the other party all the information, there's always a lot of barriers. So
Right.
it's important for me to be able to kind of facilitate the communication to make sure that both parties have understood everything that's happening, and that has also helped us a lot in terms of moving fast with the product and having something after 2 3 years, actually after 2 years, having something that we could start pilot studies with. We started pilot studies last October. We've had multiple generations of the product being made in house. We are actually on generation eighth, which looks very, very different than what we had last October,
Mm-hmm.
um, October 2020. Well, yeah, year before, and um, and it's been an amazing journey ever since.
It is. And like I said, kudos to you guys and your team. Hiring is like the number one because that's your team. That's the people, like you said, you're brainstorming with. Like you want to have those amazing ideas and putting all those people in the same room. And it sounds like you have to definitely be the facilitator for all those groups and everything. So good on you. Like I love this.
Thank
This is amazing to be around other people kind of in the
you.
same sort of like space, like leadership roles.
Yeah.
So yeah, you're welcome. With the underwear, how does Fibra Smart underwear differ from like the traditional method of like the tracking for reproductive health? Because a lot of stuff out there, and what makes it kind of the game changer in the space?
Yeah, that's a very good question. So, in terms of reproductive health,
Mhm.
although we have a very kind of specific mission of wanting to tackle every aspect of reproductive health, today's focus of the product is fertility and helping women and couples get pregnant faster. If we are talking about that feature specifically, um, those who are trying to conceive naturally, they have multiple options. The first option is to rely on their unreliable period tracking apps.
Mm,
And it's unreliable because it takes a very generalized algorithm and it
yeah.
applies that to every single woman on earth, which
Yes.
is not the case. Our hormones are different, and essentially, even drinking alcohol, drinking caffeine can affect and shift your hormones.
Yeah.
And also, women like myself who have PCOS and my other friends who have endometriosis, our cycles are even more unpredictable. And that was also one of the reasons that I wanted to have kind of a product that could monitor my reproductive system and my cycles more accurate compared to the apps, because what apps and period tracking apps lack are specific and personalized data from your body
Yeah.
to provide that accurate personalized prediction. And what we miss and what we are actually providing is each of those data points from your body, and we actually send that to the machine learning model which we are developing in house, and that is actually providing a much more accurate predictions in terms of your fertility window, in terms of your ovulation window, and in terms of where you are within your menstrual cycle. And that's one category. The other categories are invasive vaginal fertility trackers that women have to insert into themselves, which is invasive and not it more often than not, it doesn't provide a continuous method of monitoring your reproductive system or fertility.
Hmm.
In some cases, women just have to like leave it on for a couple hours, take it out, and then see the data. And no one wants to have electronics inside their body.
Yeah.
Another category of products are disposable ovulation strips that women have to urinate on. Again, who wants to wake up every day, pee on a stick for months and months to see if today is their ovulation day or not? And that method doesn't even provide any predictions in terms of, even if you're not ovulating today, when are you going to ovulate essentially? So with that being said, with the method that we are providing, it's non-invasive. It's as comfortable as any other underwear. I'm actually wearing the underwear right now. It's monitoring my data.
I would ask
I'm
you to
actually
show
kind
it,
of
but that's not kind of.
yeah, yeah. No, it's monitoring my data, and it's as seamless and as non-invasive as that. It's washable, it's reusable, it's comfortable, and also it provides a mean for continuous monitoring of my fertile window and my reproductive system. Now, that is the first focus of the product. As soon as we go to market, we're going to start on the next features of the product. The next features of the products are actually pregnancy detection as fast as possible, which is very important for those who are trying for pregnancy, but also for those who are trying to avoid pregnancy. It's important if they know if they are pregnant as fast as possible so that they can proceed accordingly. And the next phase is bacterial vaginosis detection, STD and UTI detection, and monitoring women. So, fertility is just the first phase of the product. The next phase is pregnancy detection as fast as possible, which is very important for those who are trying to get pregnant, but also for those who are trying to avoid pregnancy. And pregnancy monitoring is the other feature that we're going to be working on. Also, sexually transmitted diseases and UTIs, and monitoring women for any symptoms related to that, notifying them as fast as possible, as well as bacterial vaginosis, yeast infections, menopause, and perimenopause. Because even for me, for majority of the women that are also very well educated, they're living in a developed country, menopause is a very ambiguous world and a very ambiguous bubble that they don't have that much information on unless they have gone through that. And even if they have gone through that, everything they had to learn, they had to learn by themselves. And providing information and data and monitoring women for menopause and perimenopause symptoms is also very important. And that's one of the future features that we're going to be adding to Fibra. I attended a gala at Women's College Hospital in downtown Toronto a couple months ago. And interestingly and sadly enough, something that they mentioned was that every week, they have to actually admit patients and women who come to the emergency room and they are experiencing some symptoms and they don't know that it's totally normal and it's actually menopause or perimenopause symptoms.
Wow.
And they are worried about it. They think that there's something wrong with their body. And it's not, and it's the lack of information. We are talking about a very, again, well-educated group of women living in Toronto, living in downtown Toronto, who are coming to one of the major hospitals in Toronto. And I cannot even imagine how is the state of lack of information for developing countries, for even for cities who are not as urban as Toronto or as other cities in Canada or in the States.
That's crazy just to think that, like, just in modern day society. And it sounds like you guys have a lot of stuff going on, even for the future, pregnancy,
Yeah.
STDs, all that kind of stuff, and menopause. I think this is fabulous for a lot of women out there. Like, this ticks a lot of boxes. What kind of data does it actually take in the underwear to collect, and how can women use this information to make more like informed decisions about their health? So, kind of for the women that are listening, can it be used for like infertility? Like, is it going to give them actual information?
Right. So, in terms of the parameters and data, we monitor skin temperature, pH of vaginal discharge, volume change of vaginal discharge, heart rate, and also other biochemical concentration in different bodily fluids, which nobody else has done that before. Even today, if you want to check the pH of your vaginal discharge, you cannot do it at home. You have to go to your gynecologist. They take a swab test. They have to insert it into you, and they have to take the test, take the sample, take it out, and see based on the color change if the pH of the vaginal discharges is okay or not. Which again is ridiculous in the 21st century.
Right.
What we have developed with our proprietary sensors in house is that we have developed yarns and textiles that have the capability to monitor the vaginal discharge pH and volume and other biomarkers that we're monitoring at this time.
That's
Now,
really cool.
um, with that being said, all of the predictions and graphs that you're going to see in the app are related to prediction of ovulation and fertility at this time. We are not at this time, again, we are not monitoring women for either infertility or bacterial vaginosis or the different changes in pH. But when you're using the product, you are able to see if you had a very sudden and abnormal change in the volume of vaginal discharge or in the pH of vaginal discharge. And each of these parameters we're going to be using in the future features with the product to again monitor women for bacterial vaginosis, for yeast infection, for UTIs, and so on and so forth.
That's pretty cool. Like you said, it's kind of today's society where you have to go to the doctor to kind of just get the pH looked at and things like that. Like it makes it so much more convenient, like for women. So what challenges have women traditionally faced kind of in like monitoring like their reproductive health, and how does Fibra help overcome these obstacles for them now?
So one of the major obstacles is access to that data. Again, I as a woman, if I want to have access to the pH to the data related to the pH of my vaginal discharge, I have to book an appointment with my gynecologist,
Yeah.
and that typically takes weeks or months, and then go to the doctor, undergo that invasive procedure of that swab test, spend money on that, which most of the time it's covered by insurance. But if we're talking about countries like the
US.
United States,
Hmm.
it's a cost that's added to it's a burden that's added to to women themselves actually.
Hmm. Exactly.
And then afterwards I have to wait for weeks to see that data, and by then
And then
we
it's
are
gone.
talking about exactly we're talking about months and months of wait time. So access to that data is the most important and I think the most prominent obstacle at this time. And after that would be having non-invasive methods to monitor these parameters, to monitor women for UTI, for bacterial vaginosis, and even pregnancy monitoring.
Hmm.
One of the features that we have in mind is to do pregnancy monitoring with the underwear, with the sensors that we currently have, which is very important for again for those who are going through pregnancy. And I have actually spoken with many women who have had that experience themselves, and one of the main concerns was the health of themselves and the health of the baby that they were carrying.
Yes.
And if they have that ease of mind through the data that we're providing to them, then it's going to decrease the level of stress that they go through during their pregnancy.
And that also affects the body, as we all know, right? So the
Exactly.
pH and everything, stress can affect that too. So that's super interesting. So for women dealing with like irregular cycles, conditions like what you mentioned, PCOS or endometriosis, which is clients I see, PCOS myself, how does Fibra's technology provide like the clarity and complement sort of any medical or holistic approaches that they're using right now?
Mhm. So, in terms of Fibra's smart underwear, just to clarify, it doesn't have therapeutic effect at this time. It's just for monitoring women's cycles. And with that being said, related to PCOS, again, I have PCOS myself. I have many friends who have endometriosis or PCOS.
Yeah.
Um, in terms of cycle tracking, something that is with PCOS, we all know that women who have PCOS they experience irregular menstrual cycles,
Mhm.
and with the data that we are collecting from their body, we are able to provide precise cycle tracking and data to them. And Fibra sensors that we have within that underwear, it monitors again biomarkers like vaginal discharge, skin temperature, and based on that data, we are able to provide personalized and precise cycle tracking to them. And we have, and that's actually one of the good things about the product. The other aspect of that is a comprehensive health insights that we provide to women who have PCOS, and also the resources that we provide in the app to them. Um, and on top of all of that, it's essentially, again, the accessibility and convenience of their data and their predictions, and a model, like a predictive model that uses the data from their body, because we know that, again, women with PCOS, they have irregular changes in their hormones, they have irregular changes in other biomarkers and parameters from their body. And we use that changes in their data to, again, in the future notify them if we see any extreme abnormalities, or if we are if they are again experiencing extreme abnormalities. Because I, as someone who has PCOS, my PCOS states is not that extreme. Having said that, my hormones again are all over the place, and my periods are sometimes regular, well, somewhat regular, and there are months that my hormones again are all over the place.
Right.
So having that knowledge and having that information about how irregular my cycle is can actually help me to see if my PCOS is getting worse or is actually getting better, or how
Right.
I'm managing that. But again, today's focus of the product is again just fertility, tracking cycles for those who are trying to get pregnant.
So that's the good thing, because it means that it's sort of helping like show the woman basically that whatever they're doing is working. So like if they're maybe doing
Exactly.
something with their nutrition or anything like that, and it could be changing their pH, like you
Mhm.
said, helping maybe their cycles become more regular, you'll start to
Mhm.
see that with the actual data, which is great, because that's
Exactly.
what you were saying is basically they get all the data. I think what I see most often is women are using more of like the ovulation kits on a regular
Hmm.
basis, probably just more I don't know if it's more cost effective, but it seems to be sort of the ongoing thing. And
Hmm.
like you said, it doesn't really give that sort of predictability of like understanding, well, like what is the actual data really for, like when are you
Hmm.
ovulating? And it becomes sort of like an obsession,
Hmm.
unfortunately. So it's nice to like be able just to wear the underwear and get the data. So I want to sort of talk about the technology, because you mentioned the app a few times. So how user friendly is the technology for women new to tracking their reproductive health? Do they have to charge the underwear, and like what resources like or support does Fibra offer to help them get started? So is this like a mobile app that they're connected to with their underwear?
Exactly. So, having a seamless aspect to the design, both from the user experience and also the integration of the wearable device to their everyday life, was one of the top priority for us when we were designing the product. With that being said, we've collaborated with many experts in the UX design field, in the fashion design field, to make sure that the seamless integration is there through the different iterations of the product. Um, Now, what users have to do is to actually just wear the underwear. We have a detachable electronic unit with on and off button. It has LEDs. It shows you when it's on, when it's off, how is the battery stage of the electronic, and you just turn that on, attach it to the underwear, and connect to the underwear in Fibra's app. It's as easy and as seamless as that. When you want to charge it, you just detach that electronic unit, put it into charge. You can use any types of charging that you're comfortable with, either wireless charging stations or USB-C charging stations, and that's it. You just plug it in, turn it on, and then once it's charged, then you attach it back onto the underwear. And then in the app, we provide different articles. We provide, which are educational articles. We provide graphs. We provide data related to each of the parameters that we just talked about. We provide different, essentially just calendar views. We provide predictions, and we give you that opportunity to have access to future predictions for, let's say, for the next coming months, or for the next coming weeks. And it's essentially as easy as that.
That's wonderful. I think that makes it so seamless for women trying to sort of track and see where they're at. Because, like you said, the problem that I think a lot of us have, especially if we're not sort of in that like generalized category, is that a lot of these apps and things like that are kind of saying that this is what you should be expecting, but your normal is maybe not that. So,
Mhm.
and then we're seeing a lot more of this, like a lot of more hormonal imbalance, a lot more fertility issues, pregnancy issues, all that kind of stuff. So I love the fact that you're thinking in the future for pregnancy, you're thinking in the future for like perimenopause, menopause, all that kind of stuff, because like that would help women on their journey from being like a teen all the way up to basically like
Yeah.
her senior year. So this is fabulous. So is there anything that you would like to sort of touch on or give words of wisdom or anything to ladies that are starting this, or maybe where they can maybe sign up on a wait list with you?
Mhm. Yeah, for sure. So we have a wait list for the product. We are going to the market in the next coming months. And with that being said, sign up for our wait list. You're gonna get 15% off on the purchase of the product once you go to market with it, and join our community of 5,000 women who are actively waiting for the product, who are actively receiving our updates every month to see where we are with the product and the journey that we are on. As a woman who is working on a female related product, there is a lot of challenges that we have to face, including the lack of data. So, my word of wisdom for those who are in the research field, perhaps, or for scientists who are listening to this, is to every time that you're working on a research, always try to find how you can find ways in terms of how you can utilize that data to give back to women's health research community. One of the reasons that our product is actually what we had to do years of research and development on that was because of the lack of data.
Mm,
A simple example of that would be for one of the for some of the sensors, we've had to come up with a synthetic vaginal discharge medium or solution that we could make in the lab, so that we were able to test the sensors with it to see if the sensors are operating properly, whether it's the pH sensor or whether it's a volume sensor. Now, we had to spend months and months into figuring out what are the exact concentrations of different macromolecules or micromolecules or ions within human vaginal discharge to be able to kind of replicate that in the lab.
mm.
And we couldn't find reliable information. We couldn't find exact concentration, and we had to rely on articles from 1970s that they
Oh,
had done
wow.
research on that. Yes.
Bad.
But the
Yeah.
interesting thing, though, is that we could find articles published last year, 2 years ago, actually, in 2023, where they had done research. They had provided exact concentration of these macromolecules, but for vaginal discharge in cows. But we don't have information for women. And the one that we had to rely on was for 1970s,
Wow.
which is very heartbreaking, but that kind of motivates us even more to want to give back that data to the research community, so that other startups like ours or other researchers can build on that and move forward with new innovative products.
Wow, that's amazing. So much information. I love it. So, where can our listeners actually find you? Would you like them to go to your website, the wait list?
Check out our website at fibrainc.ca. We have links of products on the website. Get on the wait list and check our LinkedIn page. Check us at Instagram. Check our TikTok account, and we provide a lot of updates in terms of where we are with the product on all of the social media channels that we have.
Wonderful. So, I'm going to put all these notes here into our show notes for the listener. So, thank you so much for coming on to the show, and stay tuned for our next episode, everybody. And don't forget to like and subscribe so you never miss a show. In good health, everybody.